My name is Yannick de Dycker. I'm a specialist in obstetrics and gynecology. I'm Belgian. I grew up in Rome and in Geneva. Actually, my father was a UN functioneer, so he moved then to The Hague and back to Geneva, but in the meantime I graduated in Brussels. I clearly remember my first lesson of obstetrics about the delivery, and then I knew that I was going to work on that topic, and after that I made my way in obstetrics and gynecology. I did my residency in Brussels, in a surgical department, gynecological surgical department, and then also in Geneva. And I continued my post-residency in obstetrics in different university hospitals, in HUG, in 2 hospitals in Brussels and also in Paris. So I have 3 children, aged 3 to 10, so I like to spend as much time as possible with them. Actually, my youngest child was born here in Grangettes, and I was able to experience this caring aspect of the clinic here. And then, of course, I try to do a little bit of physical activity and to sports, but I'm quite busy with my job and spending as much time as possible with my family. So my job is about taking care of women's health. So that means younger women dealing with contraception issues, couples suffering of fertility issues, menopause problems. I also have surgical activity, but a large part of my activity is dedicated to follow-up of pregnancies and deliveries. At the clinic, the maternity, the Clinique de Grangettes, Hirslanden, we take care of patients according to the latest standards. That means in terms of delivery unit organization, that we have the operating room inside the delivery unit. We work with a very well-trained medical staff, also linked to the fact that we have a high number of deliveries. Always available anesthetists and neonatologists. Regarding healthy pregnant women, give an extra effort on their well-being with specific antenatal programs and training programs by our physiotherapists. And then regarding the childbirthing, we will constantly try to be careful to the communication between the couple or the patient and the medical staff, and birth plan can be in that sense discussed. Regarding C-sections, we can offer or suggest a participative cesarean section. That means that mom and dad will be able to look at the baby being delivered at that right moment, and so she can have the first glance with her baby, and we will bring then baby back to her, and baby will be kept on mom's chest during the whole procedure. So there is no separation anymore between mom and baby. Neither afterwards in the awakening room, and that is a very important procedure, and it means a lot of success. We have a lot of positive feedbacks about this procedure. There's a little story I could tell about baby Arthur, whose mom had a planned second C-section, and she insisted absolutely about having a participative C-section. But by then, at that time, we weren't completely ready for that procedure. And she insisted so much that we finally said, okay, we catch up and let's go for that procedure. And I must say that during the procedure in the operating room, all the members of the operating room were getting emotional, and there was a very particular atmosphere. And so the mom was also very grateful, and that convinced us in this way of doing. So a couple of years ago, we spoke about obstetrical violences. That meant those rude words or aggressive behavior from healthcare providers, or lack of communication leading to stress and confusion. And communication cannot be neglected anymore, and care has to be given in a respectful way. Pregnancy is linked to a lot of changes in the body, a loss of control, some psychological changes too. We speak of transparence psychique, that is the way the psyche, maternal psyche changes during pregnancy, and that is linked with our previous personal experiences, early experiences. When we think also of the delivery itself, the childbirthing itself, it is quite a wild experience. And all this shows us clearly that the pregnancy is a very particular period of life. And so more and more we need to deal with respectful, individualized care, of course assuming the best outcome for the patient and her baby, but respecting the autonomy and the wishes of the moms. I think later we will also continue to improve natural birthing, trying to reduce the cesarean section rate that is too high in most countries. We will have a future natural room also in the delivery ward here, and that is for the healthy pregnancies. And for the contrario, for the at-risk pregnancies, we will more and more collaborate in a multidisciplinary way with high-risk pregnancy centers, as we have here too. And I think future concerns also the fetal medicine aspect with genetics. Knowledge and techniques about genetics are moving forward quickly. We're now able, with a simple blood test, to look at fetal DNA, and that gives us a very good, accurate result about trisomy 13, 18, and 21 mainly, which are the major chromosomic aneuploidies. And the genetic diagnosis is increasing and is enhanced now also with the fetal exome sequencing. And giving us these genetic diagnoses are very important for the couples for regarding outcome, prognosis, chances in another pregnancy. And this is a great advance, future advance.